Started. So I'm Lauren Hall, and I'm a methodologist at the Specialist Centre for Public Health. And I'm here today to just give you a bite-sized introduction of the most commonly used qualitative analysis methods within public health. So here's an overview of today's session. We're going to go through what is qualitative analysis, why is it important for public health research. I'm going to take you through some of these methods: thematic analysis, reflexive thematic analysis, framework analysis, a few types of discourse analysis, and content analysis. We'll have some time for questions at the end. However, as this is a bite-sized webinar, some of the questions that might require a lot more longer or detailed answer will be followed up next week with responses collectively. Recordings, slides, and additional resources will be sent after the webinar, and we would really appreciate it if you could fill out our feedback form to evaluate this webinar and provide any future learnings.
See them occasionally.
Yeah.
So what is qualitative analysis? So it's a method for examining non-numerical data. So for example, interviews, focus groups, or documents like policy documents. It focuses on understanding meaning, experiences, and perspectives, and explores the how or why something happens, uncovering patterns, themes, and insights from your data. And it is really useful for addressing questions that are contextually dependent, social, or behavioural. Why is it important in public health research? So it gives voice to lived experiences. So it captures the views, needs, and experiences of public, patients, and professionals, and helps to understand the barriers or enablers to health behaviours and services. And it explains the how and the why. So it goes beyond numbers, though it can be used with numbers. It goes out just a bit further to explain why interventions succeed or fail. And we can use it to help explore context, culture, and meaning behind public health outcomes. It supports policy and practice. So it informs service design, delivery, and improvement. And it helps you to tailor interventions that can be more acceptable, accessible, and effective. And as I said, it complements quantitative data. So it adds depth and context to statistical findings. So you may find yourself using interview data as well as survey data. And this can help interpret and make sense of trends in health data. So we're going to start going through thematic analysis. So this is one of the most commonly used, I'd say, in public health. So I'm going to go through this method in a bit more depth than the others. So what is thematic analysis? So it's an analysis method to identify, analyse, and interpret patterns of meaning within the data. And it requires the involvement and interpretation of the researcher to form these certain themes from the data. It's not bound by any, it's not bound or governed by any specific theoretical framework. So you can pair it with constructivism, for example, how the social context is constructed, or positivist theoretical framework. So it's very flexible, and it can be inductive or deductive. So I'm going to go through the practicalities of thematic analysis and how we do it. To do this, we've looked at Braun and Clark's 2021 6 phases of how to conduct thematic analysis. It's important that though these are laid out in 6 phases, it's not a linear process. You might have to go back from stage 3 to stage 4, for example, throughout your analysis process. And we can use management tools to help us throughout the process, such as in Vivo. So the first stage is familiarizing yourself with the data. So firstly, we will read and review our data, for example, our interview data that we might have just conducted, and we will take any notes, thoughts, or observations, anything that interests you that might be linked to your research question. And this helps you get familiar and fully engaged with the data, and is a process called immersion. Secondly, we start to code our data. So this is where you start to develop categories within the text and develop theories. So these concepts are identified through coding. So we closely examine the data, picking out parts that are interesting or important that are normally linked to our research question. And each part is labeled with a code to describe it. Most of the time we use something called a code book to manage our codes. So this is where we'd write all our codes down, an explanation of what our codes may be, and maybe some examples of where the code is seen within the data. Now, these codes can be semantic. So semantic codes are normally what is said, what is directly said. So it could be that something positive is called positive, or it might be latent, which means the code name means something deeper behind what is said. Thirdly, we generate initial themes. So we group these codes together to form shared patterns or ideas across the data. And these patterns may become a starting point for our themes. So I've given an example here. So an example theme could be barriers to healthy lifestyle change. And the codes that might fit into this theme could be lack of time due to work or family commitments, limited access to affordable, healthy food, low motivation or confidence to make changes. So you can see how those codes may be factors that affect barriers to healthy lifestyle change. And this could come out throughout your interview transcripts and data. Then we develop and review our themes. So we check that our themes fit well with the codes and the original data. And we also make sure they're clear, accurate, and meaningful. We may need to adjust them or combine them to reflect the data. So I know when I've been doing thematic analysis, I think I've gone back to stage 2 after this, then 3, then 4, maybe back again. So it's all just about adjusting it so it fits with your data and fits with your interpretations as well. So the 5th stage is where we refine, define, and name our themes. So this is the finalization part. So that you can clearly capture your central idea, and then you write a clear, meaningful description of each theme. And each theme is giving a name that is both creative and easy to understand. And then finally, we write up. So this is where you tell the story of your findings using your data. So you use quotes or examples from your data to support your themes and what's going on in the data. And you show how your themes can answer your research questions. So that was a quick whistle stop of how we would do thematic analysis. Now I'm going to go through 2 different types of thematic analysis. So the first is reflexive thematic analysis. So this is a reflexive thematic analysis is an approach to thematic analysis developed by Braun and Clark. And it focuses on reflexivity. So it's about you as a researcher, your background, your influence, and your role. And you reflect on this throughout the process. So researcher subjectivity is embraced and actually treated as a tool for doing analysis, not something that we want to control. So the key features of RTA are that there's no fixed rules on how many themes you want to generate. It's more about the quality than the quantity, and you must use your own judgment and interpretation to define and ensure the consistency of the themes. And we can do this inductively, so the themes emerge from the data itself and are not shaped by prior frameworks or prior theory or our expectations of how the data might be. Or we can do this deductively, which is guided by existing theory or concepts. Another type of thematic analysis is framework analysis or framework method. So this is a systematic and flexible method for using qualitative data. So this is very different to reflexive thematic analysis as it's more structured. And it is a tool for supporting thematic analysis. So it's most suitable for interview data, as you can compare within and between your cases, your participants, and it's workable for analysing large amounts of data. It maintains the context of individuals while allowing for cross-case comparison. Though it's more labour intensive than thematic analysis, it gives more rigour. It's more transparent and can be replicated easier. And this is suitable for novice researchers. So these are the 7 stages that Gale et al. Recommend when doing framework analysis. So the main difference here from these stages than from thematic analysis stages is that we're putting the codes into a table with other data, and that's part of your analysis process, and that goes into your reporting as well. So firstly, we transcribe the interviews, then we do the familiarization again, then the coding, we apply descriptive labels to the extracts, and then we develop the analytical framework. So we group codes into categories. And then we do indexing, which is applying the framework across all of the data. And then charting. So this is where you're putting your themes and codes into the columns and then putting your extracts in, as well as where that was found within the participant. And then you can compare with other participants and compare across your data set. And then mapping and interpretation. So this is where you identify your patterns and you answer your research questions. So it is, it's very different to thematic analysis, but it's used in public health research mainly because it keeps the, it ties closely to the original data and your research objectives, and findings can be directly mapped to actionable insights. It also helps to answer specific policy relevant questions rather than generally creating theoretical insights. And it works well with pre-existing concepts or frameworks so that you can compare. So moving away from thematic analysis, we're now on to discourse analysis. So this is very different in the sense that discourse analysis is a method for studying how language is used in real life situations. So it looks at what people say, how they say it, and what it means in that specific context. It also helps reveal hidden meanings, power dynamics, and social norms, and it's great for analysing how language shapes public understanding. So this works well for interviews, focus groups, policies, reports, and campaigns. So why use it in public health? So it's great to understand how health issues are framed, for example, in the media or the policies. It's great to explore language that may stigmatize, exclude, or empower groups. And it helps design better communication services and policies. So I've just done a table here to show some of the types of discourse analysis. So there's a large range and they're all very different to each other. But I've also circled 2 that mainly pop up in public health research. So narrative analysis, which is how people tell stories to make sense of their experiences, and document analysis, which is examining the written materials, for example, policies and reports, to see how ideas are framed or communicated. And finally, we've got content analysis. So this is similar to thematic analysis in the sense it looks for specific themes. However, these are more keywords than the specific context that you interpret. So it's a method for systematically examining written, spoken, or visual communication. And it differs from thematic analysis in the sense it can be quantitative or qualitative. So it focuses on counting and categorizing words, themes, or concepts in text, or can be purely interpretive. But it helps to summarize large amounts of data in an organized way. So it's normally developed inductively from the data itself and focuses on informational content of open-ended responses to understand meaning, views, or experiences. So it can be used in open-ended survey questions or interviews, for example. It's widely used in applied health research. So we use it to understand practical questions and inform policy and practice. And it is also considered as atheoretical, meaning it's not bound to a specific theory, and is great for research in the real world context. So in public health, it's important as it identifies common topics, concerns, or attitudes in documents or interviews. You can track changes in public health messaging or media coverage over time, and it supports evaluations of policies, campaigns, or service feedback. So content analysis, for example, if you were looking at a document and you want to know how many times it's talked about research, you would count the amount of times the word research is used. So that's how it differs a bit from thematic. So we've very quickly discussed thematic analysis, reflexive thematic analysis, framework analysis, discourse analysis, and content analysis. All of these slides will be provided, and I've put together a slide deck of relevant readings for each type of analysis if you want to have a more in-depth understanding of how to do them and how to use them. And also, we at the RSS Specialist Centre Public Health, we provide further support if you have a research idea or you want to discuss any more of these methods in depth. And I'll be happy to take any questions anyone may have. Let's stop sharing.
There's a question on the chat, Lauren, if you maybe want to go to that one first while people are thinking of their questions. So it's from Lauren Leaston. Hi Lauren, what free software can I signpost colleagues to thematically analyse qualitative data, please? Some of us have access to NVivo due to our own links with universities and research roles, but not all do. But any ideas on that?
Hi Lorna. Yeah, that's quite a difficult one. I can get back to you on that one. I think this is something that we're scoping as a centre ourselves for local authorities and what software you have access to. NVivo's, a widely used one, but I will get back to you on that question, Lorna, once we've done a bit of scoping.
Thanks, Lauren.
Thanks, Ravi. So we've got a question here saying, is it necessary to utilise a software if sample size is fairly limited, 10 to 12 participants? No, it's not. I've done thematic analysis many a time without using software. You just have to make sure you're managing your data in just a structured way so that you don't get lost. So I use Word and Excel if I'm not using a software. And a lot of colour coding. I think someone's got their hand up.
Yeah.
Hi, thanks. Hitton here from Lambeth HDRC. I'm just wondering, thank you for your presentation. So in quantitative methods, I suppose we have an approach to what methods to use when to answer what sort of questions. So in thematic, in qualitative methods, do you have a framework to decide which approach to use? So do I use thematic analysis, or do I use framework analysis or content analysis? How do I decide?
Okay, so I think it depends on what question you want to answer and what data you want to look at. So it first depends on what do you want to look at. So for example, if you want to look at people's experiences of I don't know, an intervention within a local authority, and you know that you might only be able to reach, let's say, 12 people, well, if you want a more in-depth analysis, I would go for a thematic analysis, because then you can speak to people through interviews and focus groups and then map out what their main experiences were, whether they're positive or negative. I would use content analysis more for a broader question, and if you are looking at a lot more data but you don't want that in-depth experience, for example. Framework analysis is also great if you've got a large amount of interviews, so you've got a large amount of participants and maybe got a few more researchers working on analysing the data, because it's quite rigorous. And it also depends on like it depends on what kind of theoretical approach you want to take. So I think framework analysis is more generalizable than like reflexive thematic analysis. But if you want to be transparent about where you come from and how your views might change your interpretation of the data, and you've got less participants, you could go for reflexive. I don't know if that sounds fully, but I mean, I can have
that's
a
really
look.
useful. So that, I mean, I think you were explaining that there is a framework to approach this, I suppose. And I suppose, is there a flow diagram or something like that that helps us do that? Or
I can have a look. I haven't used one personally, but that's probably because I've been trained in this, so I can kind of figure it out in my head. But I know there will be something out there, so we can have a look at that and send that over to you. Or if there's not, I can create one.
Great, thanks.
If that's helpful.
Yeah.
How concerned should I be in terms of the type of methodological frameworks while choosing the analytic method? Say I'm using grounded theory to understand satisfaction and I want to use narrative analysis, which would lead to themes. Nathis, is that how you pronounce your name? Sorry if I've pronounced that wrong. Can I get back to you on that question, as it's quite specific, if that's okay? So Laura has asked, how can we manage data when using Excel to understand a thematic analysis, specifically at the third stage of Braun and Clark? So the third stage being generating initial themes. So what I would normally do if I had my transcripts in, and I'm not using in vivo, if I had my transcripts in like a Word document, I will start to go through and highlight in different colours specific like codes, you could call them, but they're a bit more premature than that. I will just start to highlight things that interest me and kind of make like a generalized code as to what they're talking about. And that's what I put into my Excel sheet, for example. And then this is how like your code book starts to form. So then I'd put the code where it is in my transcript, what participants said it, and a bit of the extract, and then an explanation of what this code means. And once I've done that and gone through all my data, I can then start to look at my codes and think, well, those two codes are kind of saying very similar things and could fit into something broader, which then I would then generalize and put into a theme. And then I go through and color code my code book into themes as to where each code fits together. Does that answer your question, Laura? So I'm going to answer a few more.
Hi, Laura. Sorry, it's Laura.
Hi,
here.
Laura.
Hi. Yes, it does. But so when you say you go through each one, is it because if you've coded your transcripts and saved them as individual files, do you advise to collate it all together, or you go through participant 1, 2, 3, looking for likes and things like that across each one?
Yeah. So I keep them separate. So for managing your data, normally it's on an encrypted hard drive or a OneDrive, and I normally will have the transcript and then the recording underneath the transcript, so I can listen while I'm reading, and then I will go through each transcript one by one. So it's very dependent on how many people you have on your team, if it's and how many interviews you have. So that's what we normally do. Is if there's a larger team of like, I don't know, 4 to 5 researchers, we'll all work from the same code book, so we can see what each other are doing while we're going through. And they're normally live documents, so there's no crossover.
Okay, thank you so much, Lauren.
You're welcome. Right, we've got 5 minutes left, so I'm going to answer a few more questions. For analysis to achieve rigor, it's recommended that thematic analysis is conducted by at least 2 people. However, within local authorities, having a second person to conduct analysis might be stretching. Are there any recommendations if only one person does the analysis? So that's where I think your reflexive thematic analysis could come in, if you're taking that approach to say, well, it's only very transparent as a researcher to say there's one person doing this, here's my background, here's my position in society. So you could take that approach, or you could take the framework analysis approach, which brings in a lot of rigor, and you can do that as one researcher. Reflexive thematic analysis versus thematic analysis, please say something about the difference. So I think the main difference is in thematic analysis is quite practical, and I actually specialize more in reflexive thematic analysis purely because I know as a researcher that my views can change how I interpret something. So for example, while I was doing my degree, I was a care worker in the community. And then when I did my PhD, I was analysing interviews of people who receive care. So my interpretation of that data might be very different to someone who hasn't been a care worker. Not to say that neither are wrong or right, it's just a very different interpretation. So I made sure within the process of doing my reflexive thematic analysis, I was aware of how my positionality could change my data. And I wrote this up in my reporting as well as to where I sit and how that might change my interpretations. Whereas thematic analysis is a bit more practical and doesn't require so much reflexive practice. Is there a more rigorous way to transform descriptive themes to analytical themes with the Thomas and Hardy's method of thematic synthesis? I will get back to you on that one if that's okay. We'll add that to our FAQ list. Can AI be used to support these processes? Yes, but to a certain point. As qualitative is very heavily reliant on the interpretation of the researcher. It can be used to form certain ideas that you might then develop on. But yes, to a degree, I think, to a certain degree. Yes, the slides and the recordings will be shared with everyone. I think that's all the questions, except for the few that I need to add to the FAQ to be sent out. Shall I wrap up, Alex, Nicola?
Yes, that's great, Lauren. Sorry, I was just popping in the chat there. People will see it. That reference to using AI in your research. We have got one of our future webinars around that. So Dr. Frances Mackay from Gateshead HDRC will be presenting on that topic. So if you haven't signed up for that, please do so. And we've got other webinars. There's a couple more that will be launched over the next few days as well. So we're giving people a little bit of a break over the summer. But the series starts again in earnest in September. So just left for me to say thank you so much to Dr. Lauren Hall for the excellent webinar today. And as Lauren stated, we know some of the questions from today were going to be quite in-depth, so we will put together a written document that comes out with the slides, the recording, and that evaluation form that's been mentioned as well. So thank you so much for everybody attending today. And please do keep that QR code handy if you've got any more in-depth questions or anything that the Specialist Centre can help support with. Please use that QR code or drop us an email. We're always delighted to help in any way we can. So thank you so much, Lauren. Take care, everybody. Thank you. Bye-bye.